A junior doctor has released a song in protest over the imposition of the junior doctor contract. Songwriter and junior doctor Rishi Dhir joins us now alongside producer and guitarist with Faithless, Dave Randall.
Particularly with what's been going on with the imposition of this new contract and some of the difficulties that junior doctors have faced, it kind of felt like a rallying call to action. I felt that, you know, as doctors, we're the front line on the National Health Service. We're the people who have to stand up and protect our patients. So that's why I got interested in the sort of political side of things. Now, why did I use a song to get the message across? Well, you know, people say that a picture paints 1,000 words. Well, I think a great song, paints 1,000 messages.
And she knows that that I'm engaged politically and that I can produce records. So she suggested that Dr. Rishi come and has a chat with me, and I was delighted to get on board.
Perfect fit. Dr. Rishi, I mean, what is the major bugbear that you have with the new contract?
I suppose there's three main reasons. Number one, it doesn't give junior doctors any protection against whistleblowing. Number two, the safeguards that they had in place before to stop junior doctors from being overworked, you know, the saying tired doctors make mistakes, those have gone and they're not adequately being introduced into the new contract. And number three as well, it's also quite discriminatory. It's discriminatory against women, less than full-time trainees, anybody who takes time out of medicine. And I suppose the last point, this contract is completely untested, it's unmodelled. If you said to any politician, what's your motivation to produce a 7-day NHS, what does that actually mean and what is the cost of it?
I just think, as a whole, junior doctors should hang their heads in shame. It is morally repugnant to strike. Patients cannot timetable when they are going to be ill. They cannot legislate, and I know myself because I've experienced that patchy weekend care many years ago when I had a threatened miscarriage and I had to wait till Monday to find out whether the baby was still viable or not because there just wasn't a scanning unit in place. So I know all about, from a personal point of view, and I'm sure lots of people have as well. We cannot have this chaotic, bullying, emotional blackmailing. You're quite right, the police aren't allowed to strike because if you have a public service upon which people's lives depend, then you cannot withdraw labour just because you think that you're not earning enough. You will have a decent salary at the end of your training. A lot of people work 7 days a week. We have a 7-day-a-week.
OK, Rishi, give Rishi the
Could I just come back to that?
Yes.
So first of all, a couple of points that you've made there. So you said, if I get ill, patients cannot control when they get ill. So what you're referring there to is an emergency, which runs 7 days a week.
Managing the
Secondly, you've said that this is an issue just about pay. I've got a year to go before I become a consultant. The junior doctor's contract dispute in terms of pay does not affect me directly. If anything, striking, I would actually lose out on pay. I have to say I agree with you in one sense, Angela, because I read a very interesting article of yours last year on the 30th of November 2015. You wrote in the Telegraph that why should patients wait to see doctors? And you spoke about your experience with your sons in fracture clinic when you were having to wait for long periods of time. And it was interesting that your closing statement mentioned that how can the government push through a 7-day service? Is that really the priority? And that we should be looking to strengthen the 5-day non-emergency service. And I absolutely agree with you. I have worked in a fracture clinic at my last hospital.
They're not mutually.
I have worked in a fracture clinic in my last hospital where 3 doctors covered 130 fracture clinic patients in 3 hours. I spent 3 minutes per patient. That is not good care. That is not safe care. We get lucky at the moment. The system at the moment is in a state of where, if anything happens, if a doctor gets sick, if a patient gets sick, if a member of auxiliary staff gets sick, it collapses. And you are precipitating that collapse when your own risk register leaked 2 weeks ago, said a 5 out of 5 severity risk. This is understaffed. This is underfunded. And I have to go back to some of your polls that you mentioned as well. You said that public support is waning towards a strike. The ITV poll at the weekend showed there's an 85% support for this strike.
How does that compare with April? That was my point.
The poll of 127,400 members of the public, where they surveyed them, they said, do you think a 7-day service is a priority, a 7-day non-emergency service? Less than 3% thought it was a priority. They thought that improving the 5-day service was a priority. And the last point I would like to make is the second thing, and a lot of people are not aware about this, is junior doctors do not have adequate whistleblowing protection in the new contract. And this is a massive point for me, because at the moment, if I see a problem being done to my patients, harm, malpractice, I want to be able to report that safely so that I can actually improve the service and stop harm being done to patients. So you are putting doctors between a rock and a hard place. You are asking me to be complicit in driving through a contract which I know causes harm, which the government knows causes harm, and then you are saying don't report if any harm actually occurs.
All
so
right,
you will lead to a culture of cover-up.
Just so everybody gets it. Mike was Conservative MP. Do you respond directly to this gentleman?
There are very clear proposals and improvements on whistleblowers in terms of making sure that junior doctors are being protected, equivalent to being employees of Health Education England, so they'll have the legal protection for whistleblowing. But in terms of the staffing you mentioned, it's simply not true to say that we're trying to stretch a 5-day staff over a 7-day service. Obviously, there are 9,000 more doctors now than there were 6 years ago. We're training another 11,500 doctors as part of 80,000 more staff across the NHS.
There's a 20% less intake into medical schools this year. I believe that I'm actually in a little bit of an unfair advantage over you, Mr. Wood, because I've worked in the NHS for 10 years. Unfortunately, I do know what it takes to staff that. I do know what it takes to staff a weekend service, and I'm sorry, but that is not true. It's common knowledge now that we're trying to squeeze 5 days into 7 on no extra funding. But of another problem, and this is, I think, is probably even a more important problem, is there is no whistleblowing protection in the new contract. So what that means is if junior doctors see that a patient is having harm done to them, if there's any malpractice, they will not be able to report it without fear of getting struck off, without fear, and it's happened to people before. And the third point is we don't have employment law. We don't have a named employer on our contract. Health Education England decides a junior doctor's career, but is completely exempt from any tribunal rights. So it means after 10 years of working in the health service, I do not have rights to a tribunal. I just want to go back to what you said as well about staff shortages. There is a massive problem with morale in the NHS. There's a recruitment and retention problem at the moment. And I think a lot of this comes to not only competency, but it's also trust. I think doctors as a body have lost massive trust in this government. We've seen the first junior doctor strikes in a generation. We've seen nurses being balloted and accessing food banks for the possibility of strikes. And we saw a landmark case last Friday on whistleblowing. So junior doctors have been actively cheated out of whistleblowing protection by this government since 2015 after the Francis report into Mid-Staffordshire. And that was thrown out at one of the highest courts of appeal last Friday. And this is worrying me as a doctor who's near the end of his training.
Do you accept that something somewhere within the NHS has to give or has to change because we are all living longer?
I would argue that something does need to change. What needs to change is the amount of money that's been promised for the NHS and which should be spent on it adequately needs to be put in. Yes, the population is living longer in the last 40 years. They're not living longer in the last 5 years. There hasn't been a sudden change in the last 5 years in people's life expectancy and what they're expecting to do as well. There has been a political decision to defund the NHS. We should be having this discussion about a trade-off. I think this is more like a sell-off rather than a trade-off. Cleaning, maternity, radiology services, to perhaps the biggest Trojan horse of all, the private finance initiatives. Privatisation is not the solution to this crisis.
I wrote this song, I tried to get a message out, and I want you guys to do the same in 2 weeks. Use your vote wisely. Here we go, one last time, come on.